Hello YouTube, my name is Ellie, and this is Chappie, and you might remember her from the first video, and if you don't remember her from the first video, because this is the first video you've ever watched of mine, allow me to introduce myself. So, I am celebrating my 3rd year on testosterone in this video. What do you say to that, huh? I'm a non-binary person, for lack of a better word. What it means for me is I was born female and I grew up as a girl and I've lived as a woman for many years. And at a certain age, I think I was about 27 or 26, I noticed that I really wasn't, there was something wrong for me. I needed to change, and it's been a long, slow process, but I think I can say now that I'm more of a, if anything, I'm more of a guy than a girl, I guess. Definitely not a girl anymore. And I don't strictly desire to become a cis for cisgender. I don't know that I really want to become like a fully 100% unclockable stealth male presenting person. I'm very happy as I am. I do plan on continuing to take testosterone, and what it will do is it will masculinize me further, but from this point onward, I'm just welcoming the changes. As long as they don't involve me losing all of my hair. So, this is not a typical 3-year video because I took very low doses of testosterone. I think the lowest of all the YouTubers that I've met was me. Yes, I know you want to get off, but you need to let me unhook your hand from my collar. Oh, look at all this hair. Okay, so I took a very small doses of testosterone the entire first year that I was on it. And so the changes that I experienced were minuscule and very slow. So if you are a person who is considering taking very low dose testosterone, you can reference my earlier videos to see sort of what you can expect. I know that there's not a lot of good research, good academic quality research on it, and that it's actually a resource that might be useful for endocrinologists. And I hope it's a resource that is used by trans people, that helps them sort of understand what to expect and what they might experience, because of course everyone's experience on hormones is different, but I'm hoping it's a useful tool for people out there, as other people's recorded experience was super useful to me. But anyway, enough of the boring exposition. Let's get down to what you guys, girls, people want to hear about, which is obviously updates and changes. So, first of all, I want to say that during the COVID-19 quarantine, which for me had been the last 3 months of my life, I had actually taken to up my dosage of testosterone because, and I'm going to be completely honest with you guys, I did it without consulting a doctor, an endocrinologist, and I just had the stuff in my house and just decided to take more, which is an awful thing to do. Don't do it. It's dangerous. Testosterone can elevate hemoglobin platelets in your blood, which, let's not get into exactly how the science works, but it could form blood clots and it could be dangerous for your life. So please don't do it. I sort of had a weird healthcare situation here in my hands because I immigrated to Spain about 1.5 years ago, and it took me a while to get into the system, and it took me a while to get access to transgender healthcare, and I was just impatient, to be completely honest. I did not experience any blood clots or severe health problems resulting from me taking an excess of testosterone or upping my dose without consulting a doctor, but I still don't recommend it because even though it didn't happen to me, it could happen to anyone else who does it. So please be careful, monitor yourself, and just don't fucking do what I did. Okay, and now let's talk a little bit about what happened during that. Well, I think it was more like 1.5 months that I've been on a really high dose of testosterone, those 75 milligrams of testosterone topical gel that I apply daily by just just applying it to my skin. So the first thing that happened is I noticed an intense and sharp increase in libido, which is the impulse to well, it's a sexual desire or the impulse to have sex or whatever you want to call it. So I noticed that went up pretty sharply. If you don't want to hear about genitalia, just mute the video until I do this sign, okay? Because I do want to mention it with a few words. And if you're family, please don't, you know, just if you're family or if you're a close friend, and you want to talk to me about these things, just call me, we'll talk. Don't listen to the videos. Okay, so we're going to talk about genitalia in 1, 2, 3, go. So, a lot of trans-masculine people who take testosterone report on dryness or vaginal dryness. Thankfully, that's not my experience, rather the contrary. I know bottom growth or clitoral growth is something that a lot of people are either concerned about because they don't want it going into taking testosterone, or very excited about because they would like to grow genitalia that are more similar to cis male genitalia. In my experience, taking a larger dose of testosterone does not change that. So whether you're very afraid of it or or it's high on your wish list, taking more T is not the thing that's going to change it. One thing that did augment noticeably once I took testosterone was my ability to build muscle, which I'm going to show you in a second. I think I grew a size in shirts in this month. You can definitely see it with this costume that I'm currently wearing. This is actually my wedding clothes. I think something like 2.5 years ago, roughly around this time of year, I got married. Well, I obviously wasn't barefoot, but this is what I wore. I mean, I had a different binder. It was white, but the rest of it is the same. And I think I actually look better in it now. I have more shoulders and less hips. It's not the most flattering costume. I don't think this color is the one that best suits wide hips that you're trying to sort of narrow. And I don't think that a white shirt that shows your binder is also the most dysphoria safe thing to be wearing. But I look good and I'm happy with the costume. I'm no longer in a relationship with the person I married because we went our separate ways. And some days I don't feel amazing about that. And some days I'm just happy that I got to go my own way and feel better. And I hope that she's going her own way and feeling better because I don't wish bad upon her in any way. But I was extremely happy to put this shirt on and realize that the way it fitted me on the seams, because you see the seams, that's that suture right here, it's supposed to sit right in the middle of your shoulder in a dress shirt. And that's exactly what it does here. And the last time I put it on, which I think was about a year ago, it was definitely not there. It was definitely like out to here or something. So my shoulders have gotten a lot wider. I don't know to say that my waist has gotten smaller. In fact, I think I've lost a little bit of my waistline. I think it's kind of like sort of squared out, which I'm not unhappy about. I honestly couldn't care less. I never really had an hourglass figure and I don't mind it going away. Sorry about that. Yeah, where was I going with that? So, they tell you like that your wedding is supposed to be the happiest day in your life, right? But often it is not. And for me, for example, today, this is a much happier day than the actual day I got married, which was filled with anxiety and uncertainties and unknown variables, which didn't really have, well, some of them had to do with my relationship and my family, but the event itself, I'm not the marrying kind, and I didn't have a great big wish to marry. And today, with the way my life is going, I'm actually a lot happier. And there's a lot of things that were unclear then and are clear now, and I'm happy about the way they turned out. So that's about that. Now, my voice has definitely dropped again. I'm also making a conscious effort to use what they call a chest voice or a tummy voice, which I still feel silly doing this, but I've noticed that if I don't take conscious notice of it, then I will just resort back to speaking in my head voice, which is kind of like the voice that I've always used. And I don't like that. I much prefer to have a lower voice, even if it costs me a little bit of effort to get used to it. Okay, so you guys probably want to see what my body looks like right now. And to be honest, when I look through my videos, this is always the part that I skip to. So let's go. This is actually a Velcro tie. I love it. I think it's absolutely gorgeous. And I also noticed when I went through my own videos that I have the exact same binder on in all of my videos. Well, no, there's like 2 of them that I have a different binder, but I apparently really like this purple one. So, let's start with my face. Let's take you guys to the sunlight. I think it's fairly obvious to say that I have a bit of a beard now. I have this going on, and my hairline has receded because my hairline, I don't know if you guys can see, it used to go into kind of like this point, and now it's further out from the eyebrow, and you can definitely see it in the other side of my face as well. The hair used to come down to here, and now it's all the way out to here, which I'm going to talk about in a moment once I've shown you my flourishing neck beard. Is actually the reason that I decided that being on a very, very, very high dose of testosterone, which was also self-administered and not in any way controlled, was maybe not the best idea. I noticed, looking through my own photos, that within a month, my hairline receded 1 centimeter back. And if you're American, 1 centimeter is about the width of a finger. Well, if you have really small fingers, it could be 1.5 fingers. But it's less than 1 inch. That's all I know to say to you. And I was very unhappy about that because I genuinely do not want to experience male pattern baldness. It is the single thing that I on the testosterone wish list, it's pretty much the only one I crossed out. I've always said that I would attempt to dose down as soon as I got to losing some of my hair, and fortunately that has not happened to me prior to taking 75 milligrams a day. That is, on the 50 a day, I still did not experience hair loss, at least not that pronounced. And once I went up to 75, I looked at pictures from the start of the quarantine and 1 month on the higher dose, and I was just like, damn, that's 1 centimeter of hair recession, which is not slow by any means. So I am actually slowly ramping down to 50, and I'm going to stay on the 50 unless I notice that the hair growth is not going back to what it used to be. So in that case, I will go down again because I do not want to lose my hair. I might do this periodically just to let my hair sort of regain strength and then slowly dose up again until I see that I have reached the highest point of testosterone, that I can't dose any higher because then it will start to fall out. But I have no intention of staying on this higher dose and losing my head hair, even though it has brought me really nice changes in physique. So now I have these guys. So I looked at all the videos of myself where I mentioned that I'm ripped and I'm buff and all of that, and I really wasn't. I was really noodle-armed and kind of chubby. But this is what I have going on now. These are my shoulders. And this is what my back looks like. And I suppose I should show you guys my stomach, but there's really not a lot to see here. I mean, I definitely have more hair on the lower part of my stomach, but it's not very significant. Let me show you guys. I don't know if you can see. There's definitely more hair on my stomach than there used to be. And one more thing is that there is more hair on the underside of my arms. And maybe slightly more hair on the upper side of my shoulders. But I still don't have back hair. I just have acne. Every time I change my dosage, I get a shitstorm of acne. Mostly on whatever parts of my body are covered from the sun. So I have developed this little theory that maybe it's a lack of sun exposure combined with the hormone therapy that is making me break out in zits. But it could just also be my shitty genetics, which is making me break out in zits. Okay, so that was body changes, that was acne, voice drop, sex drive, genitalia, and now the last bit would be, I guess, fat redistribution. So I have not really lost weight or gained weight in the last 6 months. However, my pants do fit differently. This did not used to be this loose. It was definitely a tight pair of pants, and it was not loose around the hips per se. So it was kind of tight all the way here. So I think it is fair to say that my hips have gotten narrower. And definitely I can say that the upper part of my body has gotten wider. So it is fairly obvious that I have more of a cone shape now. An hourglass figure. I never really had an hourglass figure, but I definitely have more of a cone shape, especially if I stand with my legs together, that you could see that my shoulders are just that much wider than my hips, which I love. It's amazing. It's exactly what I wanted. I'm doing a lot of physical activity, and I've seen people ask this, like, how long does it take since you start taking testosterone until you start seeing that your muscle grows by itself? And I just wanted to correct that very, very common mistake that muscle grows by itself. It doesn't. It only grows when it is presented with stimulus, which basically means training. You have to train. You will grow more muscle if you train when you're on testosterone as opposed to when you're not on testosterone. But your muscles will not just magically appear if you're on testosterone and you're not stimulating them. Yes, it is true that if you have a higher level of testosterone because you're a cisgender male or because you're on testosterone supplementation like I am, then your basic muscle mass will be higher than if you didn't have that testosterone. But it's still the same thing. Your muscles are responding to the stimulus you're giving to them. So your everyday stimulus as a female, you had a certain baseline. I mean endocrinologically female, which means that you have dominantly estrogen in your system. I don't mean that you have female parts. It doesn't actually play a role. So if you're hormonally female, you have a certain baseline. And if you're hormonally male, you have a slightly elevated baseline. But most people who ask about these things are not talking about baseline. They want to get jacked. They want to have big muscles. They want to have a V-taper. They want to have narrow hips and wide shoulders. And that sort of thing involves fat redistribution, which is a process that is extremely accelerated by things like eating a good, healthy, balanced diet and exercising, especially cardiovascular exercise. And the other things that really accelerate this process is building muscle, which is brought upon by resistance training, or if you've never trained at all, any kind of exercise you will do will make you grow muscle, which is wonderful because you could literally start going for walks and dance with 30-minute choreography YouTube videos, which are a lot of fun, and you will see your frame begin to change. If you want more advice on this, you can definitely contact me. I'm not going to work online, so I'm not going to charge anyone. But if you're a transgender person and you want to get some non-dangerous tips on how to start exercising, you are welcome to ask me my personal opinion. Once again, this is not a consultancy. I'm not offering anyone my services as a personal trainer nor as a physical therapist. I am both. But I'm not going to give this service online to anybody. I'm just going to point out a few common knowledge tips to anyone who is starting out and doesn't know where to begin and doesn't know what being transgender or on hormones might implicate for this process. So feel free to ask me respectful, relevant questions on the subjects, and I will try my best to give you answers which are safe and helpful. Okay, that out of the way, I might talk a little bit about, I don't know, maybe dating, maybe, yeah, that sort of thing. So I have recently come out of a very meaningful relationship, which we stayed together for 5 years. And when I was in that relationship, I always felt that my being trans, my transitioning, my being on hormones was something that my ex-wife was not against, but it was not something that she celebrated, which is her thing. It's not mine. Now that I am free to date, I find that I am intimidated by the thought that I will once again find myself with a person who won't celebrate the way that I'm changing my life and my body. And I really am scared of the responses that I might get from potential partners. So I haven't actually dated. That's all I needed to say. I haven't really actually dated. And I want to admit that in front of the whole fucking YouTube community. Just in case there's anybody out there who feels the same way, I want you guys to know this is perfectly normal. It's just the thing that our brain does when we've had certain experiences. Or maybe it doesn't have anything to do with my experience with my ex-wife. It's just something that I feel because I have these fears. And I've been going on like dating apps and all of that sort of thing. And I have been chatting to people, and I've met some people who were genuinely interested, but I can't say that I'm genuinely interested because I'm not really done working through my shit, personal shit, breakup shit, and I guess I'm just not ready to date yet. So that's that. What else? I have been passing 100%. Unless I take my shirt off and people actually see that I have a binder or a sports bra, I pass, which is very nice. I am now, I now have male privilege accessible to me, which I try to be aware of. I try to not look at women on the street the way I used to look at them when I was a woman and it was acceptable. I try to never sort of interfere with women while they're talking, and I pay more attention to let women finish their sentences around me, so I don't use that male privilege to kind of force my explanations or my opinions. I try to voice feminist opinions when I'm speaking to cisgender men because they don't know I'm trans, and it's kind of a cool way in. It's a Trojan horse, really, if you think about it. You can use that privilege to do a lot of good in the world. And then, what else? I haven't been to the gym at all, so I can't really talk about gym experience. And I think that's it for today. So, thank you very much. And I wish I was one of those cool YouTubers who does montages of how their body has changed in the last 3 years, but I don't know how to do that. So just feel free to flip through my old videos and kind of like compare them. And if you have any questions or things you want me to speak about, then go right ahead. I did get one question on my last video about being a physical therapist and being transgender, which I think was fairly interesting, and I might do that video in the near future. So feel free to leave questions that you have for me, and I will try to get to them. I have a happy, healthy day, and see you guys soon. Ciao.